Vaping has become increasingly popular in recent years, often marketed as a safer alternative to smoking. But is it really as harmless as it seems? The truth is, vaping comes with its own set of hidden dangers that can have serious consequences for your health. From lung damage to heart problems and even explosions, the risks are real and there's something you need to be aware of. Many people, especially young adults, are drawn to vaping because of the variety of flavors and the perception that it's less harmful than traditional cigarettes. But don't let the fruity flavors and sleek designs fool you. Vaping involves inhaling a heated aerosol that contains a cocktail of chemicals, some of which are known to be toxic. This essay will delve into the hidden dangers of vaping, providing you with the information you need to make informed decisions about your health. We'll explore the risks, debunk the myths, and provide you with safer alternatives if you're looking to quit smoking. Your health is precious, so let's separate fact from fiction and understand the real impact of vaping. One of the most alarming risks associated with vaping is the development of severe lung illnesses. These illnesses can be sudden and severe, often requiring immediate medical attention and sometimes leading to long-term health issues. One such condition is EVALI, which stands for e-cigarette or vaping product use-associated lung injury. This condition has become a significant public health concern due to its rapid onset and the severity of its symptoms. EVALI first made headlines in 2019 and has since been linked to thousands of hospitalizations and even deaths. The sudden surge in cases prompted extensive research and investigation into the causes and risk factors associated with vaping. Symptoms of EVALI can be quite frightening and may include coughing, shortness of breath, chest pain, fever, nausea, vomiting, and diarrhea. These symptoms can escalate quickly, leading to severe respiratory distress and the need for urgent medical care. In severe cases, EVALI can lead to respiratory failure, requiring patients to be placed on ventilators to help them breathe. This can result in prolonged hospital stays and significant medical interventions to support the patient's recovery. While the exact cause of EVALI is still being investigated, it's believed to be strongly linked to the presence of vitamin E acetate, an additive found in some THC-containing vaping products. This substance, when inhaled, can cause significant damage to the lung tissue. Another serious lung condition linked to vaping is bronchiolitis obliterans, also known as popcorn lung. This condition is characterized by the scarring and narrowing of the smallest airways in the lungs, leading to severe respiratory issues. This condition gets its name from a case where factory workers who inhaled artificial butter flavoring used in microwave popcorn developed severe lung damage. The exposure to these chemicals in the workplace environment led to significant health problems for these workers. The culprit in this case was diacetyl, a chemical also found in some e-cigarette flavors. Diacetyl is used to create a buttery flavor, but its inhalation can be extremely harmful to the lungs. Diacetyl causes inflammation and scarring in the smallest airways of the lungs, leading to coughing, wheezing, shortness of breath, and even respiratory failure. The damage caused by diacetyl can be irreversible, leading to chronic respiratory issues. These are just two examples of the serious lung conditions that have been linked to vaping. The use of e-cigarettes and vaping products poses significant risks to lung health, and the long-term effects are still not fully understood. It's important to remember that our lungs are delicate organs, and inhaling heated chemicals, regardless of their source, can have devastating consequences. Protecting lung health should be a priority, and avoiding the use of harmful substances is a crucial step in maintaining respiratory well-being. For individuals with pre-existing respiratory conditions like asthma and bronchitis, vaping can exacerbate their symptoms and lead to serious complications. The chemicals and particles in e-cigarette aerosols can act as irritants, making it harder for these individuals to manage their conditions. Asthma is a chronic condition that affects the airways, causing them to become inflamed and narrow, making it difficult to breathe. This inflammation can be triggered by various factors, including allergens, cold air, and physical activity. Bronchitis, on the other hand, is an inflammation of the bronchial tubes, which carry air to and from the lungs. It can be acute or chronic, with chronic bronchitis being a long-term condition often caused by smoking or exposure to other irritants. Vaping can trigger asthma attacks and worsen bronchitis symptoms due to the presence of irritants and inflammatory substances in e-cigarette aerosols. These substances include nicotine, flavorings, and other chemicals that can harm the respiratory system. These substances can irritate the airways, causing them to constrict and produce excess mucus, making it harder to breathe. The inflammation and mucus production can lead to a cycle of worsening symptoms and increased difficulty in managing the conditions. Imagine a person with asthma taking a puff from a vape pen. The irritants in the aerosol immediately trigger inflammation in their airways, causing them to narrow. This rapid response can be frightening and dangerous for the individual. The irritants in the aerosol immediately trigger inflammation in their airways, causing them to narrow. This leads to shortness of breath, wheezing, coughing, and chest tightness. These symptoms can escalate quickly, requiring immediate medical attention. This leads to shortness of breath, wheezing, coughing, and chest tightness. In severe cases, it can even lead to a life-threatening asthma attack, necessitating emergency intervention. In severe cases, it can even lead to a life-threatening asthma attack. The need for emergency medical care can be a terrifying experience for both the individual and their loved ones. Similarly, for someone with bronchitis, vaping can further irritate their already inflamed bronchial tubes. The additional irritation can make it even more challenging to breathe and manage their symptoms. This can worsen their cough, increase mucus production, and make it difficult to clear their airways. The excess mucus can lead to blockages, making it harder for air to flow in and out of the lungs, leading to increased discomfort and potentially more serious respiratory problems. The ongoing irritation and inflammation can result in a decline in overall lung function, making everyday activities more strenuous and reducing the quality of life for those affected. Nicotine, the addictive substance found in cigarettes, is also present in most e-cigarettes. This chemical is what makes smoking so hard to quit, and it's no different when it comes to vaping. While the levels of nicotine in vape products can vary, some contain levels comparable to or even higher than traditional cigarettes. This means that even though vaping is often marketed as a safer alternative, it can be just as addictive, if not more so. This is particularly concerning when it comes to young people, as their brains are still developing and are more vulnerable to the effects of nicotine. The social aspect of vaping also makes it more appealing to teenagers, who may not fully understand the risks involved. Nicotine affects the brain by targeting its reward pathways. These pathways are responsible for feelings of pleasure and reward, which is why nicotine can be so addictive. When nicotine enters the bloodstream, it triggers the release of dopamine, a neurotransmitter associated with pleasure and reward. This rush of dopamine creates a pleasurable feeling that encourages repeated use. This creates a pleasurable feeling that encourages repeated use, leading to addiction. Over time, the brain starts to rely on nicotine to release dopamine, making it harder to feel pleasure from other activities. For adolescents, whose brains are still developing, nicotine exposure can have long-lasting consequences. The developing brain is particularly sensitive to the effects of nicotine, which can alter its normal growth and function. Studies have shown that nicotine can interfere with the development of brain circuits involved in attention, learning, memory, and impulse control. This means that young people who vape are at risk of developing cognitive and behavioral issues. This can lead to problems with concentration, academic performance, and an increased risk of developing other addictions later in life. The impact on their education and future prospects can be significant. Imagine a teenager who starts vaping regularly. They might think it's harmless or just a way to fit in with their peers, but the reality is far more dangerous. The nicotine in the vape juice floods their brain, disrupting the normal development of crucial brain circuits. This disruption can have a profound impact on their mental and emotional health. As a result, they may find it harder to focus in school, struggle to remember information, and act impulsively. These challenges can make it difficult to succeed academically and socially. This can have a cascading effect on their academic performance, social life, and overall well-being. The stress and anxiety caused by these difficulties can lead to further issues, creating a vicious cycle that is hard to break. Understanding the risks associated with vaping is crucial for young people and their families. By being informed, they can make better choices and avoid the potential pitfalls of nicotine addiction. Open conversations about the dangers of vaping and the importance of brain health can help prevent young people from starting in the first place. Education and support are key in combating this growing issue.